1.5 million women in the U.S. have problems with fertility, and while many of them turn to surgery or in vitro fertilization, there is another option that does not require surgery or medication.
2, 3.
Hands up!
Joshua and Julie Ledbetter always knew they wanted children, but 2 years ago, Julie learned both of her fallopian tubes were blocked.
The first thoughts you think of are guilt, because you waited so long.
They were told their only options were adoption or in vitro, but the Ledbetters sought out a third option, and just 6 months after treatment, Julie became pregnant.
So let's just feel what's going on in this abdomen here.
Belinda Wern is a physical therapist. She specializes in treating people for lower back and pelvic pain caused by adhesion, scar tissue that forms internally after surgery, infection, or endometriosis.
It's a little bit tight. You can feel that.
In a technique similar to massaging out a knot in a muscle, Belinda massages away the adhesions that are blocking the fallopian tubes.
You just hold, and the longer you stretch it, all of a sudden it'll give and feels like it gets longer. That's what it feels like to us.
In an analysis of 1,400 women with blocked fallopian tubes, 57% became pregnant after treatment at Clear Passage, compared to national data that shows the success rate of surgery is just 22 to 34%.
They completely fixed the problem the first time around.
In fact, Julie is now pregnant with her second child. The research also showed that 54% of women whose infertility was caused by polycystic ovarian syndrome became pregnant after therapy with Clear Passage, compared to just 33% of women who had surgery. The average treatment takes 20 hours over the course of 5 days, and the total cost is around $6,000.